Assalamu alaikum. Let's discuss about a very high level topic, that is microcephaly. If head circumference is below third percentile, if head circumference is below third percentile, then we need to see the DNS. What does it mean? Dysmorphic feature or neurologic symptoms, that is developmental delay, hypotonia, or serial head circumference measurements across two or more than two declining major percentile. If it is no, then measure and plot the head circumference of parents. Measure and plot the parents' head circumference, that is benign familial microcephaly, and monitor growth and development. If it is yes, that means if there is presence of dysmorphic feature, if there is presence of neurologic symptoms, or if there is serial head circumference across two or more than two declining major percentile, then order MRI of the brain for why? To look for perinatal stroke, congenital malformation, with or without evaluation for congenital infection like cytomegalovirus, and with or without order genetic testing if dysmorphic features are present. If there is dysmorphic feature, then we need to do the genetic testing. So MRI, evaluation of the CMV, congenital infection, and genetic testing. Now, first look here. This one is macrocephaly, this one is microcephaly. Macrocephaly 0 to 2 years, microcephaly below third percentile. See closely. This is the normal growth, minor variability in the percentile without crossing the multiple major percentile, not less than sec, second percentile, or not less than third percentile, not below third percentile. It is sometimes it is way above, now it is declining, it is now it is increasing. Okay, this is the minor variability in percentile without crossing the multiple major percentile. But look at these, for from birth to 2 months there is elevation uh, near about 50 percentile, then it starts declining. In fourth month there is decline, there in 6 months there is decline, two or more decline. So abnormal growth curve crosses two or more than two major percentile in 25th, 10th. So curve crosses two or more than two major percentile, so 25, 10, and now it is starts to touching the second percentile. So this is the way of looking like curve crosses two or more than two major percentile. Initially it was 25. Look, this is 25, now 1 and 2, so it is 10. So curve crosses two or more percentile, so that's how we can calculate. But if we look at this question, if we look at this question in the there is no develop, If we just read this question, this 5-month-old baby, okay, he has begun babbling and mm, he was born full term without complication, no complication. Fontanelli is open and eyes and ears are normal, so everything is normal. No dysmorphic feature. The palate is intact. Abdomen is soft. There is no neurological problem. So, no dysmorphic feature, no neurological problem in the graph. There is no such decline. There is no such decline of head circumference, 2 or more than 2 major percentile decline. In this head circumference, it is it is almost below the third percentile constantly. So as it is below the third percentile constantly, and there is no such DNS feature, no such dysmorphic feature, no neurological problem, and no serial head circumference showing 2 or more declining of the major percentile. So our next step is measure and plot the patient's head circumference. That's what we have done, measure the patient's head circumference. But if we look at this question, look at this head circumference, the head circumference initially it touches the 10 percentile, then it starts decreasing down. Now it touches the third percentile or below the third percentile. So gradual decline, and serial head circumference show 2 or more than 2 uh, decline. So looks like we should do the MRI of the brain. Our next step is to do the MRI of the brain, and in this step, we can see that there is viral illness. Okay, patient smiles. There is decreased tone and head lag are noted. So there are some neurological problem also. Decreased tone and head lag are noted. Physical examination is otherwise unremarkable. So it looks like, so declining growth velocity indicate inadequate brain growth. So isolated macrocephaly plus relatively small um, parenteral head circumference often indicates a benign a variant growth. However, signs of concerning pathological microcephaly looks like structural or genetical, neurological problem, dysmorphic feature, rapidly declining head circumference. In this case, this 6 months old infant microcephaly with hypotonia and developmental delay. So we need to do the MRI of the brain. Neuroimaging can detect the brain malformation like encephalopathy, lesioncephaly, which is absence gyrus, or perinatal hypoxic insult white matter injury. Mm, Both conditions can affect the normal brain growth and present primarily associated with neurological problem. Neuroimaging also reveals the pattern consistent with infection, calcification with cytomegalovirus, or postnatal traumatic brain injury, non-accidental trauma. So that is all about evaluation of microcephaly. You need to understand the microcephaly. Hope you enjoyed.